welcome to the Health Channel, all health all the time. I'm Laura DeAngelis coming to you from the Baptist Health South Florida studios in Coral Gables. We are talking today about a subject that many people can relate to, aching feet, and what you can do about them. And now I am joined by Dr. Wayne Goldstein, podiatric sports medicine physician with Miami Orthopedics and Sports Medicine Institute. And Dr. Goldstein, your title alone in essence says that you are the expert in feet we have with us this morning.
Well, thanks for having me today, Laura. I always like talking about feet and helping people get back on their feet and resume to their activities that they enjoy doing.
Absolutely. Getting them on their feet literally is what we're going to do this hour. And that's great because according to the Institute for Preventive Foot Health, 80% of people aged 21 and older have a foot problem. Now, that sounds like an unbelievable statistic, but I mean, doctor, again, you just mentioned a lot of people are suffering from foot pain. So is the statistic surprising to you or not really based on what you see?
Not at all, Laura. Don't forget, we walk on our feet. We don't walk on our hands. And when we walk, just normal everyday activity, you can exert up to 120% of your body weight on your feet. And when you run, it could be 3 to 5 times your body weight on your feet. So that's a lot of trauma, a lot of steps every single day. And the feet get wear and tear.
Yeah, a lot of daily abuse, basically.
Absolutely.
No doubt about it. And a lot of weight that you're mentioning there. So when we talk about the achy feet, what are the common problems that we're talking about when it comes to foot pain?
Some of the more common problems that I see are anywhere from bunions and hammer toes to arthritis and plantar fasciitis. I would say those are the most common things that I see in my practice at Miami Orthopedic and Sports Medicine Institute.
Okay, so several different things going on with the feet, but a lot of patients coming to you for help. And again, as we said, it is safe to say millions of people are trying to get some relief from these aching feet. And we actually have a yoga instructor's story. So let's take a look at what she's going through.
In 2010, I was actually doing my yoga teacher training and I fell and I hurt my toe.
Ruth's case involved a condition where she developed what's called hallux rigidus, which is an arthritic condition of the great toe. What we ended up doing is it's a total toe joint replacement. The surfaces of the joint have become arthritic, which means that the cartilage has been worn out over time, so you have bone on bone. You've tried to restore the anatomy so that they're able to walk and function, but without the pain because the surfaces now have been replaced.
It's a little over 2 years right now, and I literally never think about it. My toe never hurts, never bothers me, and it was the best thing I ever did. My experience at Doctor's Hospital was pretty fantastic. Everybody was really accommodating and very comforting.
A favorite part of my job is taking care of patients and building that relationship with them, getting to know them and what their activities are that lead to their quality of life.
So I feel like this will lead me to be able to be doing my life's calling. So now I teach yoga also for the MS Society, which I would not have been able to do had I been halted in my yoga career.
Well, that's wonderful, doctor. I guess that kind of shows that there is hope for people. If you have foot pain, there are definitely solutions out there, right? Talk to a doctor.
Absolutely. That was one of our many excellent doctors at Miami Orthopedic and Sports Medicine Institute, and this was a perfect example of somebody getting surgical intervention for their painful foot condition. In this particular case, this doctor put in an implant in her large toe. A lot of times we hear of people undergoing implants for hips or knees, and a lot of people don't know that there are implants available for toes as well. And when you have pain and the joint is totally destroyed and we run out of all options, that is one of the options that are available.
All right, and I didn't know you could put an implant myself into the foot, so that's definitely something good to know it's out there if we need it. Now, speaking of pain, Time Magazine and the Institute for Preventive Foot Health have a few things we should all know about foot pain. Okay, so we're going to start off with the numbers here. Number 1, pay attention to everyday aches. You know, and anything from wearing the wrong footwear to high impact exercise can trigger a condition with everyday aches like bunions or worse. So, doctor, is that true?
Absolutely. Sometimes problems start very minor, and there's not a lot of discomfort, but you feel something just is not right. And that's really the time to address when there's a problem, is try to act early, get early intervention so it does not become a major problem, which is harder to treat.
Okay, definitely. And again, as I mentioned a little earlier, we talked about bunions can be a condition that cause this pain. As you're saying, you know, get there early, and there's an image of what bunions might look like in certain feet. And I can tell you, doctor, this is kind of a hot topic for me. I unfortunately do have bunions. I've had them pretty much my whole life. So I know what they are, but there are probably some viewers who might not know what they are. So tell us about bunions and why these are a painful condition.
You're very brave, Laura, to admit that you have bunions. But yes, bunions can become very painful. And really what they are a bony protuberance at usually the base of the big toe. So what happens is there's a shifting of the bone. Sometimes there's extra bone formation. And what that can lead to is that can lead to pressure from shoes. That can lead to a change of gait, the way you walk. Sometimes that can lead to other foot pain in the forefoot and the ball of your foot. And believe it or not, sometimes that can even lead to ingrown toenails just because of the shape and the angle of your big toe and the pressure from the shoe.
And doctor, you mentioned obviously there's pain, discomfort. I know finding shoes to fit me is definitely a challenge, but you mentioned something else. It can change the way you walk in your gait. And when that happens, you know, it's not just a foot issue anymore, right? You can lead to other problems, maybe with your knees. It's just kind of, you know, starting at the foot and can work its way up and affect your whole body.
For sure. And the old adage, when your feet hurt, you hurt all over, is true, because, you know, you rely on your feet as your mechanism of movement every single day. So when your feet are not in balance and you're causing pressures and forces in other areas, that can definitely lead to other problems, whether it's ankle, knee, hip, back pain. A lot of it stems from the feet.
Okay, good to know. And another last thing about bunions, is there anything we can do to prevent getting them?
Well, one of the most important things that can be done is proper shoe gear.
Okay.
A lot of times, if you are in the wrong shoes, that can help facilitate the bunion. A lot of times there's a genetic component to bunions, there's arthritic component to bunions, as well as a shoe component to bunions. So when you wear shoes, when you pick out shoes, you want to make sure they're not too tight, and you want to make sure that, you know, they're not causing a lot of pressure and discomfort on that area.
Okay, that makes good sense. Now, doctor, we're going to continue on that list that I was talking about. And number 2, or next there, is fewer pounds mean happier feet. The Institute found that obese people are more than 40% more likely to have a current foot issue. So, doctor, how significant is it when we talk about obesity and being a factor for foot pain and foot problems?
It's a big factor, obviously, very big factor. As I mentioned earlier, normal everyday walking, you can exert up to 120 pounds percentage of force on your feet. And when you run, again, 3 to 5 times force. So with the more weight you have, the more force is going on your feet. And that accelerates the problems that you might have, or you might not even have currently, but it might force it to develop a lot sooner. So keeping weight down is extremely important for your feet, as well as other parts of your body, obviously.
Yes, and in fact, you just mentioned that. I mean, we also know that obesity, unfortunately, can lead to diabetes, which leads to even more foot complications, pretty serious ones too. So I guess the question, doctor, is do you have to lose a lot of weight to make a difference? Will shedding a few pounds even help, or what would you say to folks about that?
I would say you have to start small.
Yes.
You can't lose 20 pounds overnight.
Right.
So little baby steps, you know, set realistic goals in order to achieve your big goal. So small little steps you can take every single day to help you lose weight. And then once you lose a little bit of weight, sometimes you're a little bit more motivated to even start exercising a little bit. So it's really a cyclical problem. So the more weight you gain, the slower you feel,
right,
the less you feel like exercising, and vice versa as well. So you really, really want to just start slowly, lose that weight. And you know what, my goal is for everybody, I tell them that if you can lose 10% of your body weight, you'll really make major changes in your overall health, especially your feet.
Yeah, like you said earlier, I mean, your feet, you think about all the weight that they just take every day, normal body weight, running, depending on how fast you're moving. So, but the good news is if you do a little bit of movement, right, get some exercise, you're gonna shed some of those pounds. And as you said, baby steps. I guess let's just reiterate, you're not telling people to get up and go walk 5 miles today if they can't, but a little bit at a time, right, every day.
Little bit at a time, every single day. From, you know, starting maybe parking a little bit further away in a parking lot, to go to work, to walking upstairs maybe instead of an elevator. Just every day, if you can make some small changes, it'll make a big difference.
Small changes are good. All right, doctor, we're off to a great start here, and coming up next, we're going to talk about some of the treatments that can provide relief for some of the most painful foot conditions. And later on, we're also going to learn about what kinds of shoes can keep our feet feeling good. So stay with us. You're watching the Health Channel, all health all the time. We'll be right back.
Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. While symptoms of dementia can vary greatly, at least 2 of the following must be significantly impaired to be considered dementia: memory, communication and anguish, ability to pay attention, reasoning and judgment, visual perception. If you feel like you or someone in your family might be experiencing these symptoms, contact your primary care physician so that an evaluation can be performed.
The Alter-G can be used for everything from athletic population, from young kids, high school, college, professional athletes, all the way to our older populations coming in with hip replacements, knee replacements. When you get into the treadmill, they wear a special spandex pants that has a zipper on it. You zip them in. When we turn on the treadmill, it fills up with air. It goes through a little process where it kind of gauges how much the patient weighs. It starts you at 100%, and then from there, we bring them down at that point.
I run track and cross country at St. Brennan, and my knee, I started getting knee pain in like January, so I stopped training and I started coming here. It's been good because I've been able to start running before I can actually get cleared, so it takes like the weight off my body, so it doesn't hurt as much when I run, and I can start running and getting used to like the motions and everything again before I can actually go out and train hard.
When the patient gets in it, usually they're always a little bit apprehensive, but in general, the patients usually like it a lot.
Each year, an estimated 12,000 women are diagnosed with cervical cancer. Thanks to improved screening and vaccination, cervical cancer is a highly preventable and treatable cancer. Early detection is key. Women should pay close attention to their cervical health by following these guidelines. Start testing at age 21. Women between ages 21 and 29 should have a Pap test done every 3 years. Women between the ages of 30 and 65 should have a Pap test plus an HPV test done every 5 years. A woman who has been vaccinated against HPV should still follow the screening recommendations for her age group. Your particular health history may dictate a different screening schedule for cervical cancer. Contact your primary care physician to talk about your history and schedule your next screening today.
Welcome back to the Health Channel, all health, all the time. I'm Laura DeAngelis. Our subject today, aching feet and what you can do about them. I am here with Dr. Wayne Goldstein, podiatric sports medicine physician with Miami Orthopedics and Sports Medicine Institute. Doctor, again, we're glad to have you with us to talk about foot pain, and we're going to continue now with that list of the Time magazine list of the 5 things you need to know about foot pain. We talked about everyday aches, we talked about losing some weight, and now for number 3 on that list, good shoes are essential. So doctor, we're going to get to the basics of proper footwear a little bit later, but again, please tell us why it's so important to wear proper footwear, and if we don't, what can happen? What kind of problems are we looking at?
Well, proper footwear obviously is extremely important, because if you don't wear proper footwear, you're setting yourself up for a lot of problems. When you have pressure from an ill-fitting shoe, that can cause rubbing, it can cause irritation, it can cause blisters, it can cause a collapsed arch. There's just so many things that it can cause.
Boy, the list goes on and on.
It
So
certainly does.
Make sure you've got the right footwear. Okay, well, great. So doctor, good news. We actually have a caller. We have Alicia on the line, and she's got a problem with her bunions. So she's actually wanting to talk to you about that. So Alicia, we have you on the line with Dr. Goldstein. So go ahead, ask away.
Hi, good morning, Dr. Goldstein.
Good morning, Alicia. How are you?
Good. Listen, doctor, like 5 years ago, I have this bunion. It's like it's like a ball, I call it, And I went to the doctor, and I was explained that in order to get rid of it, I would have to have the bone shaped, because it's sort of rounded. And to me at that time, I thought it was too invasive. And basically, I've been dealing with it. He sent me this cream. It's a urea cream that softens the bunion. And, sometimes it's really big, and I just kind of shave it and deal with it. But I've been noticing that I'm getting it on the other side of the foot as well. Not as bad, but I see that the bone is rounded. And I was wondering, is that the only option? Or I try to wear comfortable shoes and shoes that don't irritate it, but, that's kind of hard to also do. I don't know if there's another less invasive option to cure it.
Okay, well, Alicia, I always believe in starting conservatively first. So I always judge everything based on pain, based on your level of discomfort, based on if the pain and the problem inhibits you from everyday activities. So, if it doesn't, then obviously focus on the shoes, and creams or pads can relieve some of the pressure. Sometimes genetically, just the way you walk and the foot type that you inherit, you can get a bump on one side of the foot, which we call a bunion, and sometimes you can develop it on the outside of your foot, which it kind of sounds like you're starting to develop now, which is called a tailor's bunion, and that's on the outside of your foot. But you know, taking pressure off of the area will definitely slow down the deformity. Hopefully you'll never go on to need surgical intervention. But if you do, there's different types of surgery based on the level and the extent of the problem that you have. But really, I always start conservatively, and when all else fails, that's when you go on to the surgery.
Oh, okay. All right, doctor. Very interesting. Sure. That's how I more or less I've dealt with it for 5 years. But like I said, I was concerned because I see now that on the other side of the foot and even on one of the toes, I see a little bit of a raise, like the bone also is curved. So I'm like...
Sounds like you're also developing a little bit of a hammer toe, Alicia. So, you know, again, the most important thing is just really watch those shoes. Make sure they're not too tight and there's not pressure forcing them in an awkward fashion. But if you start developing pain and discomfort and all else fails, that's when we move on to surgical intervention to try to realign the joints and eliminate the pain and discomfort that you're having.
Oh, okay. All right. Thank you very much.
Thank you for your call, Alicia. I appreciate it.
No problem. Thank you, doctor.
Well, great to hear again from a caller. And doctor, as you said, you know, surgery is a last option. And just again, when you talk about conservative treatment first, that's what you're trying to look for. Again, just to kind of reiterate what that means and what you hope might work for a patient before you have to go into surgery.
Well, it depends on the types of issues that we're trying to deal with. If we're talking possibly about a bunion or a hammer toe, some of the conservative treatments, starting off, as we just mentioned earlier, was a change in shoe gear to make sure the shoe's not too tight, pushing the toes in an awkward fashion. Sometimes we can try certain types of pads just to take pressure off of the area that's rubbing and getting irritated. Important though, when you do get pads, you want to make sure that they're non-medicated pads. Because a lot of times the stores will sell medicated and non-medicated pads. And the non-medicated pads are the ones that you want to purchase to try to disperse the pressure. The medicated pads have a low dose of an acid usually, which can cause other kinds of problems and irritations, and they're not for this type of issue.
All right, that's good to know actually, the difference between, so important to point that out, doctor. Now, our caller also mentioned she had another issue which you referred to was probably a hammer toe. So for people who don't know what that is, let's hear about that.
Hammer toe is basically an abnormal bend in the joint
which we can
of
see
one of the
there.
lesser toes. And again, there's a genetic component to that as well as a shoe component to that. So if the shoe is too tight and it's pushing back on the toe will bend, as well as a muscle imbalance. Sometimes one of the muscles are stronger than the other muscles, which cause the toe to bend abnormally, to put it in simple terms.
And it does look pretty painful, I mean, based on the image we saw. So again, doctor, you try to treat these things conservatively, but at some point, perhaps if quality of life is really affected, we are talking about surgery. So just to let people know, especially with bunions, it seems years and years ago there was maybe one type of surgery. I know it's evolved a lot. So just tell us kind of what might be involved if someone has to have bunion surgery and how you try to fix the problem.
Well, there's a lot of different types of bunion surgery. So not every person is a square peg in a square hole. So we take a look at the individual person from their age, from their activity level, from their bone structure, to how severe the deformity is. And based on all those factors, we come up with a surgical plan in order to try to help them with their problem, to help alleviate the deformity and help them pain-free the rest of their life.
Absolutely. And these surgeries also, doctor, you mentioned there's different and no patient is the same as another. So obviously you'll be working with an individual to see what might work best for that patient. As far as recovery goes, does the recovery also differ based on the type of surgery that you might have to get, or are there shorter recovery times depending on the surgery?
For sure. So if it's more of a mild deformity, and as the caller earlier mentioned, the physician she had spoken with just wanted to shave down a piece of the bone. Well, that's more for a mild deformity, where you would shave down a piece of the bone, which is the bump, and the recovery time for that is a lot shorter, versus a more severe type of bunion procedure, which would actually involve cutting the bone and realigning the bone and holding it in place with either pins or screws. That would be a little bit longer of a recovery time. So each type of situation is different, and the recovery times are different based on the procedure that is performed. And as you mentioned, Laura, there's a lot of different types of bunion procedures. There's not just several types.
Okay, well, I guess that's good that we have options, and it's good to know that. So, Doctor, we've learned a lot about certain kinds of conditions and how to treat them, and when we come back, we are actually going to hear about another one, and that is when the heel pain comes and literally knocks you off your feet. We're going to talk about plantar fasciitis coming up next. A little later, we're also going to learn, does wearing fashionable shoes always mean sacrificing comfort? Well, I sure hope not. And please be sure to visit our website, allhealthallthetime.com, to submit your questions to Dr. Goldstein and the other experts here, and to find out all about the programming on the Health Channel on South Florida PBS. We'll be right back after the break.
Even with Medicare Part D coverage, about 5 million adults aren't taking their blood pressure medicines as directed. So why does that matter? Because high blood pressure is one of the leading causes of heart disease, stroke, kidney disease, and death in the United States. Along with healthy food choices and regular physical activity, blood pressure medicines reduce those risks, but only if prescriptions are filled in the first place. And 1 in 4 adults with Medicare Part D skip doses or stop taking their medicines altogether. Ask questions about how to correctly take your medicine and why you need it. It's easy to download free tip sheets and tools to help you or your loved ones take their blood pressure medicines on time and in the right amount. To learn more, visit millionhearts.hhs.gov.
In-toeing is basically when your child comes in and walks with their feet pointing towards the midline. Most people walk with feet out about 10 degrees, pigeon toes with the foot inside. In-toeing is very common. It's by far one of the most common reasons for us to see patients in the office. But most pediatricians do a very good job at telling you if there's something more that needs to be done. It can come from 3 different places. It can come from your thigh bone, your tibia, or your foot. And any one of those things can be curved to cause the foot to progress forward. We now know that this condition improves on its own. It doesn't cause any lasting issues, no arthritis, no other joint issues or bony issues. And the bracing can actually cause weakness that can maybe even delay the progress of them getting better on their own. More than 90% of these kids will outgrow this, absolutely.
Emily is thinking about taking a dietary supplement. She knows she should try to get her vitamins and minerals from the food she eats, but she doesn't always have the chance to eat right. And with more than 50,000 dietary supplements on the market, like a lot of other people, Emily has questions. Like how much vitamin A is good for you, and how much is too much? If something's natural, doesn't it mean it's safe? Can folic acid prevent birth defects? Should we be taking calcium and vitamin D supplements? Luckily, there's a place everyone can go for answers. It's the website of the Office of Dietary Supplements. We're part of the National Institutes of Health, and since 1995, we've been conducting, funding, and evaluating research that we use to educate the public, giving Emily plenty of information she can share and discuss with her healthcare providers. We're ODS, for what you need to know about dietary supplements.
Hello, I'm Dr. Jose Sosa with Baptist Health Primary Care. Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. While symptoms of dementia can vary greatly, at least two of the following must be significantly impaired to be considered dementia: memory, communication and anguish, ability to pay attention, reasoning and judgment, visual perception. If you feel like you or someone in your family might be experiencing these symptoms, contact your primary care physician so that an evaluation can be performed.
Welcome back to the Health Channel, all health, all the time. I'm Laura DeAngelis coming to you from the Baptist Health South Florida studios in Coral Gables. This hour, we are talking about a subject that so many people can relate to, aching feet, and we're learning what we can do about them. And that's with the help of Dr. Wayne Goldstein, podiatric sports medicine physician with Miami Orthopedics and Sports Medicine Institute. So, doctor, we've talked about common foot pain, we've talked about bunions and hammer toes, and now we are going to focus on that stabbing heel pain that starts first thing in the morning when you get out of bed. It can go away as the day continues and you get a little bit more exercise, but it often comes back towards the end of the day. We're talking about plantar fasciitis, and again, it's a name, a term that we've heard before. And doctor, please tell us, what is plantar fasciitis? Why is it so painful for so many people?
Well, basically, Laura, what plantar fasciitis is, it's an inflammation usually around the heel bone underneath your foot. There's a ligament on the bottom of your foot called the plantar fascia, and what it does is it acts as the framework, the arch of your foot. So it starts on the heel bone and it spreads out and it goes to the front of your foot. And what can happen is, the way I usually like describing it is, it's like a rubber band. So if you think of a rubber band, when you're sitting, when you're sleeping, that rubber band is nice and relaxed. And when you step down, what happens? That rubber band stretches and it has nowhere to go. So it's pulling against the heel bone and it's causing inflammation and swelling. So a lot of common types of discomfort is when you get out of bed in the morning or after you've been sleeping for, sitting for a while, you step down and you're stretching that rubber band after hours or minutes of just relaxing. So it's pulling against that heel bone and you're getting that initial pain and discomfort. Sometimes when it loosens up a little bit, it feels a little bit better. And when you're on your feet all day and it's stretching and pulling, then towards the end of the day you could get that discomfort again sometimes.
Come back. And doctor, one thing again, I seem to hear people of all ages and lifestyles suffering from plantar fasciitis. So why is it so common? What are we doing wrong, or what's happening?
Well, there's a lot of contributing factors to it. At my practice at Miami Orthopedic and Sports Medicine Institute, I see a lot of cases every single day of plantar fasciitis. A lot of it, again, go back to the weight issue and us being overweight and the obesity epidemic. We're putting a lot of extra pressure and forces on our foot, and the pressure is causing our foot to stretch out and pull against that ligament. Also a genetic component as well. People that are more flat-footed or roll their foot down and out are stretching that ligament past the point that it wants to go. It has nowhere else to go, so it pulls against the heel bone.
Okay, so a lot of factors contributing. We know it's painful. Let's talk about treatments and how we can help people to get some relief. So I know one of those treatments, we're starting out with physical therapy. So how does that help?
Physical therapy is a great modality. I usually have my patients at Miami Orthopedic and Sports Medicine Institute, where I treat patients, start with home physical therapy. Sometimes I'll tell them, get a bottle of drinking water, put it in the freezer, and for about 15 minutes, several times a day, roll the bottom of your foot along that frozen bottle of water. What that does is, obviously, the cold helps with the inflammation, as well as rolling it helps stretch out that ligament. If you don't have a frozen bottle of water, you could try a tennis ball or a golf ball. As well as, I have patients, before they get out of bed, sit up in bed, keep their knee locked, their legs straight, and try to bring their toes back to their face just to stretch out that ligament before they take that initial step out of bed and put pressure on it. This way it's already warmed up and stretched a little bit.
All right.
Also, during the day, they can lean up against a wall, go up and do some toe raises as well, just to help stretch that out.
That's great. And as you mentioned, doctor, you can do these things at home. You can do them at the office if you need to, or if you might be working. So physical therapy that you can start right at home and not have to move on from there. So other treatments that are available, doctor, I know that another thing that people can do is wear night splints. So how do those work?
Well, what night splints do is they hold the foot at a 90-degree angle. So while people are sleeping or sitting, it's keeping that ligament stretched again. So when they step down in the morning, they don't have that initial stretching because it's already stretched out. Sometimes the night splints can be a little uncomfortable to sleep with, but that is definitely another modality that we do use.
Okay. Again, there's a lot of treatments, which is good to know to help people with this condition. And I know another thing, you talked about the night splints to wear, but how about orthotics?
Well, there's different types of orthotics, and I always tell my patients, you can start from an over-the-counter insert orthotic more to a custom orthotic. The idea with orthotics and the goal of orthotics is to give a patient an arch and help prevent that arch from collapsing down too much and stretching out that plantar fascia ligament. Now, I always say to my patients, please be careful with the over-the-counter ones that you do purchase, because a lot of the over-the-counter ones, they're made for everybody. They're not made for your individual needs, and a lot of times, quite honestly, they just do not give the support that's needed to maintain the arch. So a lot of times, I hate to say it, but it's probably a waste of money, most of the over-the-counter orthotics that you do purchase.
All right, it's a good idea to really talk to a doctor about maybe what might work for you
For
if
sure.
you want to go down that route.
For
All right.
sure.
Again, great news. There's a lot of treatments for this common condition that can be very painful. And I know that for some people, they may also undergo injections. So are we talking about injections at the site of the heel, or how does that work, doctor?
An injection is definitely another modality that we do use. Most often it's an injection of a local anesthetic and a cortisone injection right at the site of the inflammation to target that inflammation and take down the swelling and the pain. And a lot of times they are very successful. Not always successful, but that is definitely one of the first modalities that we use to try to give a patient immediate type of relief.
Immediate relief. And is that something that could be repeated if it needed to be after a certain amount of time, doctor, or
Sure.
how is that measured?
Sure, absolutely. You know, we do sometimes give a series of injections. Not always does one injection work like a magic wand and take away the pain for forever. But, you know, if we have to, there are criteria that we do use to give a series of injections to help with that type of inflammation and discomfort.
Okay, good to know. Now, we're not done yet. I mean, again, the great news is there are a lot of options for people to talk to their doctor about possible treatments. I also understand that there's something called, there's shockwave therapy and the 10X procedure. So if you wanted to address those.
These are just two different types of procedures that are other modalities to try to treat the plantar fasciitis, the inflammation, if some of the other treatment options do fail. So, you know, those are other bullets in our bag that we can use. And
that's right, good to have them, as you said, to have them in your bag of tricks to try to get to the root of the problem. And doctor, again, last but not least, as you mentioned, even with bunions and other conditions, surgery, you always try to do the conservative methods first, but what might surgery entail for someone who's got plantar fasciitis?
Well, when all else does fail and we're left with a patient who is still having discomfort, then we do go on to surgical intervention. And there's a couple different types of surgical interventions, but most often what we do is we try to address where that plantar fascia inserts into the heel bone and release it from the heel bone to prevent future pulling and stretching on that area. But again, when we do talk about surgery and we do go on to that last step, we always discuss possible risks and complications of surgery, like any other type of surgery, and what the patient can expect long term.
Okay, but again, good to know lots of options out there. Well, doctor, I am
Yes.
learning so much about the foot and how to take care of pain and all the options out there to treat it, but we are not done yet. So when we actually come back, we're going to learn some more, and we're going to talk about how footwear and how you can select shoes that are right for you and your lifestyle. I'm excited because as a fitness fanatic, I want to know what I should be wearing. And in the meantime, please be sure to visit our website, allhealthallthetime.com. You can submit questions for the doctors and find out more about all the topics here on the Health Channel on South Florida PBS. Stay with us. We'll be right back.
The purpose of clinical research is to help understand how the human body works and how health and disease come about. So we want to understand what makes good health.
I think women's participation in clinical trials is extremely important because we have an entirely different set of issues, whatever body system you're working with, it's different from a man and from a child. So there are certainly differences there that we need to understand and focus and realize that are specific to women.
Science has shown and taught us that men and women are different in a variety of ways beyond the obvious differences. Our organs are different, our level of our hormones are different, we respond to treatments and medications differently. Based on those findings, every single cell in a woman or a man's body is a male or a female cell, and those cells respond differently to different triggers, to different treatments, and to the environment.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
Even with Medicare Part D coverage, about 5 million adults aren't taking their blood pressure medicines as directed. So why does that matter? Because high blood pressure is one of the leading causes of heart disease, stroke, kidney disease, and death in the United States. Along with healthy food choices and regular physical activity, blood pressure medicines reduce those risks, but only if prescriptions are filled in the first place. And 1 in 4 adults with Medicare Part D skip doses or stop taking their medicines altogether. Ask questions about how to correctly take your medicine and why you need it. It's easy to download free tip sheets and tools to help you or your loved ones take their blood pressure medicines on time and in the right amount. To learn more, visit millionhearts.hhs.gov.
Welcome back to the Health Channel, All Health, All the Time. I'm Laura DeAngelis, and we've been talking this hour about something pretty much all of us can probably relate to, and that is aching feet. We've been learning about the different kinds of foot pain, ways to treat them, and we've been getting that help from Dr. Wayne Goldstein, podiatric physician, and basically Dr. Goldstein's been really helping us out here, and now we're going to find out what we do when we don't know what the problem is with our feet. Sometimes all you know is that they really hurt. So we're going to take a look at the ways the experts at the Miami Orthopedics and Sports Medicine Institute are working to literally get you back on your feet. Let's take a look.
Left heel hits the ground and it's right around there. Here at Miami Orthopedics and Sports Medicine Institute, motion analysis is one of our very valuable tools, and what it allows us to see is really see our patient better. You know, when we evaluate our patients, we're looking in very, simple planes, that doesn't really correlate to what their specific task is. So with motion analysis, we can have them do their task that they're having an issue with, film it, and then analyze it and figure out why that specific task is causing their pain. So Lewis is a recreational athlete, which tore his Achilles several months ago playing basketball. And he's at the point now in his rehab where he's going back to running and trying to get back to sport, but he's having some pain in his Achilles. When evaluating him, it's difficult to figure out what exactly is causing his pain, so we decided to use the motion analysis to really look at his running from different angles and figure out if there's anything that we're missing.
I'm excited. I want to know exactly what's going on, because I'm eager to go back into playing sports. I want to go back, feeling 100%, not having a little pain here and there. So yeah, that's why I come today, because I definitely want to try this out and see how it goes.
Most patients are visual learners, so they really love being analyzed. Once the video is created, we can give it to them, we can give it to their coaches, so they can see exactly what's going on, and they can also be part of the team that helps them get better.
Okay, well, Dr. Goldstein, is it true that a lot of people really do come in and it's just kind of unknown, like why is this happening? I have this pain and what's going on?
Absolutely, and this is just another great modality that we do have at the Miami Orthopedic and Sports Medicine Institute to help evaluate what is happening and what their mechanisms are, and just even sometimes a little shift of weight can take pressure off of certain areas and prevent injury.
It's amazing, a little bit can really go a long way, and that's good news. Now, speaking of the little things we can do, this is something I have been waiting for all hour, so let's get right into it. We're going to find out what kind of footwear is best and how to know that we are making the right choice. So, doctor, this really, again, this is not a one-size-fits-all situation, right? I mean, you want to make sure you have the right footwear, and also for different conditions, whether you're working out, whether you're not working out. So let's talk about the importance of finding the right fit for you.
Very, very important, because we don't walk barefoot, so we do cover our feet, and it's important based on your activity level and what you're doing. But just a couple of general tips that I always like to give patients are to don't necessarily go by the size that you think you wear. Try on the shoe, because different shoes, different brands, sometimes even the same shoe within a brand model number, it can be different. It can fit you differently. So try that shoe on. See how it fits. Make sure there's no pressure. Make sure you're not having any discomfort. There's no stitches in an area that are rubbing and irritating. Some other general tips that I usually like to give are go more towards the end of the day to buy shoes. At the end of the day, your feet can swell, and you want to make sure that it fits properly, as well as not both feet are necessarily the same size on some people. So go with the larger fitting shoe, on the larger foot, because you don't want to have a small shoe on the larger foot, because then you're going to develop problems and irritation on that foot.
Those are actually really good tips about when a good time to go get the shoes. Now, let me ask you this again, as a bona fide fitness fanatic, I do a lot of hard intensity workouts, a lot of high impact. So for people like that who are doing a lot of heavy activity at the gym or maybe running, what would you say, again, is very important when you're looking for those athletic types of footwear?
The cushioning, Laura, definitely the cushioning. You want to be able to make sure that that shoe is absorbing the shock and the impact that you're putting on that shoe. You also, depending on your activity level, you want to change your shoes quite often as well. Look for signs of wear. If you're getting too much wear, it's time to change the shoe.
Okay, that's good to know. And as far as maybe people who are not quite as active, but perhaps they go for leisurely walks, they are pounding the pavement, so to speak, on a daily basis. What are also some general things? You mentioned cushioning for the high impact. What about stability, things like that people should be looking for when they're trying on certain shoes?
Well, people have different foot types. So, you want to make sure that the shoe or the sneaker that you're buying is for your foot type. Some people tend to roll in their feet a little bit, so you want to look for a shoe that maybe helps prevent that. based on the type of arch support that's built into the shoe.
Okay, good to know. And obviously, do you think it's a good idea? One thing, a lot of women, I think in particular, heels. Let's talk about, I mean, look, heels, fashion, we all want to look great, but just also some pointers for women out there about being smart when it comes to buying some of those heels and how they can wreak havoc on your feet if you're not careful.
There's a price for beauty, Laura. So a tip I usually like to give women, which really bring the point home, is when you're looking for a high heel or a certain shoe, bring a piece of paper and a pen with you and really draw what that toe box looks like on a piece of paper. Put your foot on top of it and look, do you see the outline of that shoe? If your foot is too wide and you don't see it, odds are that the shoe is going to be too narrow, and that's something else. We don't want a shoe to be too narrow. We want to have a wider toe box, so you're not squeezing and pushing your toes in such a narrow area, which, as we talked about earlier, can help cause bunions, hammer toes, and some of the other problems.
I will tell you, doctor, the next time I go shoe shopping, I'm going to bring that paper and pen. I've never done that before, but that's actually a great idea. I probably won't like the results. And again, we see all these pictures in the fashion magazines. The celebrities are wearing shoes. I don't know how they do it. Some of them seem to be defying gravity, right? Do you think some of them have some foot problems, doctor?
I can probably guarantee a lot of them do have foot problems, but that's the price for beauty again,
yes,
right?
Exactly what you said. And if you are going to wear heels, though, maybe for an event, something I do, and tell me if I'm doing a good thing or a bad thing here, but I might wear very comfortable shoes for most of the day, perhaps my sneakers or some other type of cushioned flat, and really try to minimize the time in the heels, bring them with me. Is that something just simple that women can do to still feel like they look great?
For sure, that's a really important point. I always tell my patients, if you're in bad shoes 10% of the time, it's a lot better than being in these bad shoes 100% of the time. So, temporarily, if you're going out for an evening and you have to look stylish and fashionable and you have to wear the shoes, go for it. But maybe also be careful, as we talked about. You can get them a little bit wider. Sometimes you can even take them and get them stretched out a little bit to make them feel more comfortable, or put a little pad that's not too tight in there just to take some of the pressure off of that area.
Okay,
but very, very good point.
Yeah, and I've done the stretching thing before. It does help a little bit to kind of widen them out.
A little bit.
All right. Well, doctor, just to get back to some general tips for everyone, not just us ladies who might be trying to look fashionable in our heels. Let's kind of wrap things up for talking about healthy tips for everyone when it comes to their feet. First of all, let's get back to why it's so important to maintain a healthy weight. How does that help us, doctor?
Healthy weight keeps pressure off of the feet. The less pressure on the feet, the better. So very important. Plus, a healthy weight, you feel a little bit more apt to go that extra mile with exercise and do that extra walking, which is just so important for your overall health.
Okay, so keeping the weight is a good thing. And we also want to make sure that we're wearing supportive shoes, right? That's the whole key, and not to wear worn out athletic shoes. So again, doctor, the importance, I don't think we can say it enough. Make sure you're wearing the right shoes, right?
Correct, for sure. You definitely cannot say it enough. Shoes you want to look at with a wide toe box, ones that fit properly. Get your shoe size checked periodically. I can't tell you how many patients I get at the Miami Orthopedic and Sports Medicine Institute that say, "Doctor, I'm a size 9." And I ask them when they had their shoe checked, their size. When I was 13. I said, well, with age as well, sometimes the ligaments loosen up, your feet widen, or they stretch out a little bit. So you do quite often want to get that size checked to make sure you are in the right size shoe.
That makes sense. I definitely know my shoes have gotten bigger as I've gotten a little older myself. So I'm glad that I'm not alone in that, and I'm not just something different. Another thing, doctor, when we were talking about some of the conditions that can plague us, and one of those common ones being plantar fasciitis. You said you see a lot of that also in your practice. So you talked about how people at home can do things like stretching the arches and using ice to kind of alleviate symptoms even before they do anything more drastic about surgery later on. So can you just refresh our memory on how to do those things at home that might make a big difference in day-to-day life?
Sure. At home, I always recommend patients, whether they're athletes or they're non-athletes, on proper stretching techniques. You know, as we age, everything tightens up a little bit. Right. So the more that we can be proactive and stretch out different parts of the body, not forgetting the feet, of course, the better it's going to be in terms of trying to help prevent different foot issues and problems. So, you know, at home, when you get up before you even get out of bed in the morning, do some foot stretches and stretch out that plantar fascia during the day. Stretch it out as well, leaning against a wall.
That makes good sense. And as you start there, guess what? You'll probably want to stretch other parts of the body. Stretching is good for us, and we just want to feel better in our day-to-day life. So Dr. Goldstein, you've given us some great tips just about how to have happy feet, healthy feet, and we also know what to do if they aren't feeling so happy and we need to see an expert. We know who to call. So Dr. Goldstein, thank you for these great, easy to follow tips for great foot care today.
My pleasure, Laura.
Great, we'll see you again here. And unfortunately, that's all the time we have today. And we thank you for watching the Health Channel, All Health, All the Time. I am Laura DeAngelis. And remember, you can always visit our website at allhealthallthetime.com. You can submit questions for the doctors. You can learn all about the topics here on the Health Channel, here on South Florida PBS. We'll have a new topic coming up in the hour. I will see you next time.